Good afternoon. May I introduce myself? My name is Islam Alexander University, Egypt. My friend.
My name is Natalika or Ugis from Thailand. My name is Jerica from ITB.
I'm Amanina Farhana from ITB.
My name is Ainu Adawya. I'm from Malaysian UKM. And my name is Arshila Idayu from Malaysia. We start our presentation with a scenario. Oh my god, I have so many notes to study. I have a test after this. I have a presentation. Oh my god, my head hurts. Oh my god, my head hurts. I wonder if it's a migraine.
Aovic, oregano AOE,
So, migraine. Migraine is a type of, generally we know that migraine is a type of headache, but migraine is not just any normal headache, because according to the International Headache Society, migraine is an episodic recurrent headache lasting for 4 to 72 hours, with the condition that the person should experience any of these two pain qualities, which is unilateral pain, which is pain on one side of the head, throbbing pain, pain worsened by movement, and also moderate or severe pain. The person should also have any one of these symptoms, which are nausea, vomiting, and also photophobia, which is sensitivity to light, and phonophobia, which is sensitivity to sound. So, migraine is considered as a neurological disorder because it affects the brain. And the root cause of migraine is still unknown to this day, but there have been several theories proposed to pinpoint the cause of migraine. And in the case of imovig, it can occur due to the excitation of a nerve that is responsible for the sensation in our face, called the trigeminal nerve. When the trigeminal nerve is stimulated, it will release a variety of neurotransmitters, including serotonin, neurokinin A, substance P, and most importantly, CGRP. So when these neurotransmitters are released, they will stimulate the blood vessels to become vasodilated, and these blood vessels will then become inflamed. So the symptoms of migraine vary from person to person depending on which stage of migraine the person is in. And not all the migraine sufferers will undergo all of these phases. Okay, so the first phase is called the prodrome phase, which is basically a type of warning phase where the person will experience symptoms like food cravings, fatigue, and also yawning a few hours or days before an actual migraine. Then the second phase is called an aura phase, where it is also a type of warning phase, where the first person would basically experience visual disturbances like flashing lights or wavy lines and also blind spots in their vision. They could also experience something called sensory aura, where they can experience numbness and also tingling in the face. After that, they could experience if they do not take any medication, then these symptoms can progress into an actual migraine attack. So when the person has an actual migraine attack, the person could have a mild headache where the person would experience symptoms like sensitivity to light, sensitivity to sound, nausea, unilateral pain, which is pain on one side of the head, and also sometimes pain in the back of the head and neck. Then it could progress to a moderate to severe headache, where the symptoms are similar to the mild headache but more severe. And for the migraine attack, it can last up to 4 to 72 hours. Then right after the migraine attack, the person will experience something called a post-drome phase, where the person would experience zombie-like symptoms, where the person will become distorted, confused, and have a lowered appetite. And these symptoms the person would usually recover from this phase for several hours and a few days. So now, by knowing all those 4 phases, we can now categorize migraine into two categories. First is migraine without aura, which is also known as the common migraine. So if the person experiences migraine without aura, there would be no aura or prodrome present. The person would also experience a unilateral throbbing headache accompanied with nausea and vomiting. And during the headache, the patient would complain of photophobia, which is sensitive to light, and phonophobia, which is sensitive to sound. The second type of headache is migraine with aura, which is also known as the classic migraine. The person would experience the aura or prodrome phase, and the unilateral throbbing headache which will later become generalized, meaning the person would first experience a pain on one side of the head, but later as the headache progresses, it will spread to both sides. So meaning that the person will experience pain on both sides of the head. And the patient will also complain of visual disturbances and may have mood variations. So, as you can see from ours, if you noticed, there are several possible triggers of a migraine attack that we have showed just now in our little scenario, where the possible triggers could be bright lights, loud noises of sounds, certain smells and odors, and also stress. There are also other possible triggers like weather changes and hormonal fluctuations and the menstrual cycle. That is why there is higher number of women who experience migraine than men. There are the ingredients that make up Imovic is the active ingredient that make up Imovic is erinumab AOOE, which is a monoclonal antibody, and the inactive ingredients are acetate, polysorbate AT, and sucrose.
So to speak more about the pathophysiology more in depth, we can show like a brain section here, like to know how migraine works. First of all, there is two theories right now in our hands. Like in the past, we believe that migraine originates from severe vasoconstriction, but like this is out of our favor now because we know that migraine is a vasodilatation. So recently, there's a theory called cortical spreading depression, which is a wave of depolarization starting along from the deep brain tissue and traveling along the cortical area, then to the brainstem. From the brainstem here, when these wave of depolarization reach the trigeminal nerve, which is like dividing into three branches, one go to the forehead, one into the cheeks, and the other in the lower jaw. So we can deduce that after the activation of the trigeminal nerve, there is a release of neuropeptides. These neuropeptides act as a vasodilator agents, and this severe vasodilatation makes the sensory neurons in the brain sensitive. That's why we feel like the throbbing pain in our head. So the neuropeptide, which is important in regulation, is CGRP, like it's the most potent neuropeptide, calcitonin gene-related peptide, also substance P and neurokinin A. Okay, so for the treatment purposes, we have two goals: either to decrease the release of the neuropeptides by inhibiting the 5H1D receptor, or we can induce vasoconstriction by serotonin receptors 5HT1B. And trypsin is the drug of choice that exert this effect. So our drug is different. It's a monoclonal antibody. It's a fully human, like 100% human monoclonal antibody, produced by CHO or Chinese hamster ovary technology. It's a recombinant technology. It's an IgG2 monoclonal antibody. It inhibits the receptor of the CGRP receptor. So it competitively binds to the receptor and prevents the CGRP from binding to the receptor, exerting the vasodilating action. And so it can be used for prophylaxis and treatment. The mechanism of action will be displayed shortly in a video.
mechanism of action. Indication. Aimovig is indicated for the preventive treatment of migraine in adults. Important safety information. The most common adverse reactions in clinical studies were injection site reactions and constipation. Please see accompanying Aimovig full prescribing information. CGRP, or calcitonin gene-related peptide, is a neuropeptide. CGRP signaling plays a key role in migraine pathophysiology by modulating nociceptive signaling within the trigeminal vascular system. Aimovig is a 100% human monoclonal antibody designed to help prevent migraine by targeting and blocking the CGRP receptor. Aimovig binds to the CGRP receptor and antagonizes CGRP receptor function. Migraine is a neurologic disease with symptoms including debilitating headaches and associated sensory dysfunctions. The trigeminal vascular system plays a critical role in peripheral and central events involved in migraine. This system functions through the release of neurotransmitters or neuropeptides. Calcitonin gene-related peptide, or CGRP, is a neuropeptide that modulates nociceptive signaling in the trigeminal vascular system. CGRP and its receptor are located in regions within this system and have been associated with migraine pathophysiology. CGRP has been implicated in a variety of migraine-related processes. The CGRP receptor is a member of the calcitonin receptor family. Other receptors in this family include the amylin, adrenomedulin, and calcitonin receptors. Of these, only the CGRP receptor has been implicated in migraine pathophysiology thus far. Although the exact role of CGRP in migraine has yet to be determined, compelling evidence supports its involvement. First, CGRP levels have been shown to increase significantly during migraine and decrease with headache relief post-sumatriptan treatment. Second, intravenous infusion of CGRP induces migraine-like headache in migraine patients, demonstrating that CGRP may play a causal role in migraine. Together, this information suggests a role for CGRP in migraine. Aimovig is a 100% human monoclonal antibody designed to help prevent migraine by targeting and blocking the CGRP receptor. Aimovig potently and specifically competes with the binding of CGRP to the CGRP receptor, thereby inhibiting receptor function. Aimovig lacks agonist activity at the CGRP receptor and has no significant pharmacological activity at amylin, adrenomedulin, and calcitonin receptors. Aimovig helps prevent migraine by targeting and blocking the CGRP receptor.
So, as we heard, the indication for the use of Aimovig is which is a calcitonin gene-related peptide inhibitor or antagonist indicated for the preventive treatment of migraine in adults. And
This dosage of Aimovig 70 mg per milliliter injected subcutaneously once monthly, and 114 mg may be beneficial for some patients. And next, the administration. We can administer the Aimovig in our skin at upper arm or stomach area or thigh. So I would like to show you how to use the auto-injector of Aimovig at the stomach. There are 4 steps. First, we have to prepare the injection site by clean your injection site by alcohol white like this, and then let your skin dry. And next, the step of ready, you have to put the white cap step off like this, and then pinch your injection site to make it firm surface like this. And then the step of inject. You have to place the injector on your skin at 90 degree here, and then you should push down your auto injector until it doesn't move. And when you're ready to start the injection, you have to push this button, and then you will hear the click sound, and it will start the injection and take around 15 seconds to finish the injection. And if your injection finish, this window will turn to yellow like this here, and then it's finished. So after finish, you have to discard the auto injector and white cap. The monitoring of the MOV, there are no specific monitoring has been determined.
Okay, next I'm going to talk about pharmacokinetics. So MOVIC, it exhibits non-linear pharmacokinetics, and its half-life is 1.6 days injected subcutaneously. Its bioavailability is 82%, which means only 82% of the drug reaches the systemic circulation. It shows maximum target engagement after single and repeated dosing. So all the receptors in this place, is the CGRP receptor. It's all binded 100% with MOVIC. It has a long serum effective half-life at doses which is more than 70 mg subcutaneously, and through the clinical trials which they tested, it shows that 50% or 99% of maximum inhibition is 255 nanogram per milliliter and 1134 nanogram per milliliter respectively.
Okay, next I will continue with adverse reaction. So the people who get the drug treatment will experience some adverse reaction, and the more common adverse reaction have been reported have included such as injection site reaction, which is affect locally. It could be injection site pain or injection site erythema. The next adverse reaction, it will affect the gastrointestinal, which is constipations. And then the last one, the patient will experience muscle spasm, causing them to have body pain or muscle pain. So next is drug and food interaction. Drug or supplement that may interact with MNOVIC, which is arenumab, have not been identified. But aranumab does not affect the breakdown of other drugs based on the laboratory studies. Other than that, the drug do not interact with medication such as sumatriptan. Sumatriptan is used for medication for migraines such as Imitrax, Imigran, and Trazimate. And it also did not interact with the oral contraceptive.
Okay, now I will continue with contraindication. For this iMovic, from the sources, there is no contraindication is found, and for the availability, iMovic is only available to access through the insurance coverage of iMovic Early Product Support Program in US, and the drug is not known in Egypt, Malaysia, Indonesia, and also Thailand. Okay, now I will continue with the clinical trials for the iMovic. For the first clinical trials is a clinical trial by David Vitodic et al. For the design is randomized and placebo, double-blinded, and also multi-center, which is have been conducted to many other countries. And the total number and the aim of the clinical trials for this trial is to evaluate the iMovic for the preventive treatment of episodic migraine. And the total number of the patients for this trial is 577, with 286 people will be injected with iMovic 70 milligram per month for 3 months, and also 291 patients with placebo. And the inclusion criteria for these clinical trials is the patient must have episodic migraine, and the exclusion criteria for the patient is headache, medication overuse, myocardial infarction, stroke, tension ischemic attack, what's another one? Unstable angina, and also coronary artery bypass graft. And the outcome and result will continue with Ina.
Okay, next, the outcome. I will talk about the outcome for the clinical trials. And the outcome, basically, we want to see the change from baseline in MMD. MMD is state for the monthly migraine days. It means that how many days you get the migraine in a month. So, what we can see from the outcome, the primary baseline in MMD decreased at month 3. And the secondary, we want to see that the secondary shows that more or equal to 50% MMD responder, which is we want to see if there is decreasing in migraine impact in responders. Then there is 5 points score reduction from baseline in MPFID, which is migraine physical function impact there at month 3. And then the last one is the results. The results show that AM is amyloid with the placebo. So the amyloid shows that MMD is negative 2.9, and the placebo it shows that negative 1.8. And for the MMD respondent, it shows that 39.7%, and for placebo, it shows 29.5%. And the last one, it states that monthly acute migraine specific medication days. That's mean the patient have the migraine after they took the medication. It shows that negative 1.2, and for the placebo, it shows that negative 0.6. This is another clinical trial on phase 3 of the ECOWID. This is a study multi-center, randomized, and double-blind. This study evaluates the efficacy and safety of ECOWID for prevent the migraine. The patients are 955 and divided into 3 groups. First, 317 will receive 70 mg per month, and another 319 will receive 140 mg per month, and another will receive placebo. And the primary outcome of this study is the reduction in mean of monthly migraine day, and the secondary outcome is percentage of patients that have more than 50% reduction in mean of monthly migraine day.
So for the results, the reduction in mean migraine days per month from baseline, at baseline it was 8.2 days, the mean of all the participants. But after taking Arianet 70 mg, the reduction was 3.2 days. For 140 mg, 3.7 days, and placebo 1.8 days. Either of the treatment versus placebo, the probability of differences was less than 0.001, and there was a more than 50% reduction in mean migraine days for 43.3% of patients in 70 mg, 50% in 140 mg, and 26.6% in placebo. What that means is, for example, we take the Arianet 70 mg. of 317 patients, 43.3% of the patient experienced more than half, which is like 50% of mean migraine days reduction. That's all from us. Thank you. Any questions?
You said that the adverse reaction of the drug, that is called an inflammation at the site of the injection. I saw that because of the drug is a monoclonal antibody, so our body can produce an antibody against that monoclonal antibody, which is called alpha reaction. So we can use a corticosteroid to reduce that adverse reaction. Is it possible?
Okay. So for this, for the
I asked you for adding a corticosteroid with that drug to reduce the adverse reaction of inflammation.
Okay. So what's it called? Okay. Yeah. For just like you were talking about anaphylaxis. Yeah, there's like different measures for anaphylaxis. Like mainly we can administer corticosteroids to reduce inflammation. And we can take other measures, like mainly it can be hospitalization. So, like, this will solve the problem.
Okay, I have another.
Like this drug. Sorry for this. Like this drug is administered like in an IV. So, okay, so it's administered mainly in the hospital.
Yes.
Okay. Sorry. So it's subcutaneous. So sorry. Maybe. Yeah. Like, we can just take the measures and hospitalization thing, so we can solve the problem.
Okay, I have another question about, you talked about the risk factors that cause the migraine, which was hormonal fluctuations that appear in a menopausal. What is the mechanism that to cause the migraine?
Discuss them. Remember, I give you time, last time, so you should be able to answer together.
Okay, for the hormonal fluctuation thing, basically, for the hormonal fluctuation, we are focusing for the women that having migraine in their period time. So in a period time, there will be the hormonal fluctuation in our body, right? So we are not sure for the mechanism of action, but it's come from there. You got any? Okay. Another question?
Come on, guys, ask me that question.
Yes.
Copy and paste. You guys need to learn it. You just ask a question. That's not suffering. Because they should be the experts. Come on.
So I see the clinical trial, right? The clinical trial. Does the result that means negative?
Repeat the question and then answer.
Repeat the question.
So I see in the clinical trial report, the one that is negative migraine. So MMC means like the migraine that they got treatment, right? So negative means what? They don't have
It
all
shows
the
a reduction. It's not negative, it's a reduction of 1.8 days per month.
The number of day getting the migraine in a month is being reduction. Another question?
What are the dose in special population like renal and hepatic impairment and category of pregnancy? And
currently there's no reports about like hepatic impairment and renal impairment. Maybe because FDA in the package insert described that this drug is eliminated by a proteolytic pathway. Okay, so it's not eliminated by the liver or the kidney. It's like that degraded because it's a monoclonal antibody made up of made of protein. You know. Okay, so. No reports, so we cannot recommend it in pregnancy, you know what I mean? Like, there is no enough reports about the category of pregnancy.
Yeah, that's for the pregnancy is for the specific population. There's several population that there's no data available for them, for the pediatric and for the pregnancy, and which this drug is just been published, so there's no data available from the hospital, so that report for the pregnancy or pediatric use that having any contraindication or adverse effect. So we couldn't have the data.
But they did the research on pregnant monkeys and there was no adverse reactions on it.
Another question, yes? Can we use this drug with the other prophylactic treatment?
Yes, we can use it as prophylaxis. Like we have in the second trial, we have like 2 dosing thing. So it's a monoclonal antibody. It can be used as a prophylaxis, administered before the attack, in a lower dose, which is the 70 milligram. Yeah, it can be used as a prophylaxis. This is your question? It can be used with other prophylactic, or it's prophylactic? Can you ask me the question again, please?
Teacher asked that if it can use with another prophylaxis or if it can use with another.
With another prophylaxis. So we don't have enough data about like the guy. Look, to just administer 2 drugs together, we have to be sure about their efficacy, and it is well published. You know what I mean, in the guidelines as a clinical study. You know, so we don't see any clinical studies recommending administering 2 drugs together. But like for Erinumab or Aimovig by itself, it can be administered as a prophylactic agent.
Why is that rules like 70 milligram and 140?
Yeah, it's like clinically. Okay. Yeah.
For the 70 and 140 milligram, 140 milligram is for the more severe and more often EM, episodic migraine. Yeah, no question.
So like in the way like you showed how to administer the drug, right? And it is specifically 90 degrees. Is there a reason why we have to add it 90 degrees, or can we add it in another? Why is it specifically 90 degrees?
So for the 90 degrees thing, you know, subcutaneously we're targeting the fats, you know what I mean? Like you have to inject the drug in the subcutaneous fat tissue. So this is why we're using this area, the belly area, you know, the stomach. And we're just like grabbing by our hands, like pinching the skin a little bit. So we just inject it 90 degrees in order for the drug to be absorbed in the fat tissue, you know? Subcutaneously, yeah. Yes?
Speak louder.
So episodic migraine is when the person experiences more than 15 days of migraine in a month. sorry. Episodic migraine is when the person suffers less than 15 days of migraine in a month. But for chronic migraine, the person will experience more than 50 days of migraine in a month for 3 consecutive months.
Any other questions?
Yes.
Do we need to inject the drug, like in the stomach, repeatedly at the same dose? It can cause adverse effect, right? So can we should we inject at the same place? Do we need to change that time we inject?
Yes, we can change so that it won't like affect only one spot. Yeah.
Like if you're just injecting insulin, you just don't inject it in just one place, you know? You just like you take the injection, like I can administer here, then here, then here, then here, then here. You just like rotate the places of injection in different places in order to avoid like the side effects we're talking about, like injecting the same place every time. Any other question? Okay.
Just a follow-up. In case like this particular monoclonal antibody is used for episodic migraine, right? So will it actually one day be the exchange for all the times that are being used now, or is it just there because you want additional types of therapies to be available? Is it too?
It's not just for episodic migraine as indicated by the FDA, right?
I think it's not because based for the cost, you know, the cost is like $100, and it's for preventive. For the somatriptan, we can take it when we are having the migraine. For this one, it's for the one that want to prevent from getting the migraine. Okay, is it? Any other questions?